PTSD is an abbreviation which stands for post-traumatic stress disorder. So post-traumatic stress disorder, or PTSD, is a condition which develops when someone has been exposed to a severe form of trauma, which is not in keeping with the usual traumatic events which you come across in life. So this is to do with events like a bad road traffic accident, floods, natural disasters, wars, being involved in organized violence and torture, those kind of activities. Anything which is not in the normal realm of the normal stressors. People will go through other stressful events, and then this is what is called adjustment disorder, because you are reacting to maybe you've lost a job, you have divorced, you've lost a spouse and things like that. It's an adjustment disorder. It's something which happens every day in life. But these unusual events are what is called post-traumatic stress disorder.
Message yakangoya kanzi Ruben Shah, then my crying emojis. I asked her, what happened? What's up? They know do that Shanzi is normal. And I was just like, is it accident? Over to send Rama screenshots.
I got a scream, like a loud scream. What did I do to myself? Then Vanatosha got what's going on, because Bakata break a glass. Then I went out to check out what's going on. And she was blood Buddha from the mouth. And I was like, oh. I was shocked. That was like my first time to see so much blood. Rich Buddha, Then I helped her sit up straight. Because I read about some things like that. But then in my mind, I was thinking with her, she's dying, because it was really intense. Like the blood was just too much.
Maybe just a bit of history. It was developed during the war times when people were exposed to war trauma. They developed what is called shell shock. So these are the symptoms of this shell shock because of the guns. That's why people believe that exposure to guns and all the shelling which was happening could have caused the PTSD symptoms. But later on, people realized that we developed the symptoms because of other things as well. We also have what is called acute stress disorder, which occurs within 3 days of being exposed to that severe trauma. But when it's post-traumatic stress disorder, which develops 6 months after the traumatic event, it's like a delayed reaction to the stress. That's the only type. There's no special type, that there's one type of special of PTSD and another type of PTSD, but it's the symptoms maybe which are variable between individuals, so they may give an impression that they are suffering from a different condition, but usually it's the same condition. The symptoms of PTSD are basically they are grouped into 3 groups. There's number 1, which is called flashbacks or re-experiencing the trauma. So when you re-experience the trauma, it's like the trauma is reoccurring, and the way it happened, the first time when it happened, say it was a road traffic accident, you can actually see the cars coming and then colliding. If it was to do with the war, you can actually start having visions of the war. Even when you're sitting there talking to your friends, you can see these pictures coming up in front of you as in form of flashbacks. They can also come in the form of nightmares. You can have these bad dreams about this traumatic event which happened to you. So that's the re-experiencing the trauma. You're actually having a re-experiencing of the whole episode as it happened whenever it happened a long time ago.
When if someone is talking something related to someone falling down to someone, I start visualizing what I saw. And sometimes when I'm just thinking about random stuff, that picture just comes back in my head of hair on the ground and blood all over the place.
Like, I could explain what happened and all, but at the end of the day, there was a toilet, there was shower. That's where I used to cry my heart out. I used to cry every second. I would take the advantage that I'm alone. I couldn't focus for more than 5 minutes without thinking the event, without crying, and
And then the other symptom group is the symptom group of being hypervigilant. Because of the flashbacks, you become hypervigilant. So the thing is, you are having heightened anxiety response to anything which tends to remind you of the trauma. So we find people are having serious anxiety symptoms like palpitations, they're very common, sweating, numbness of hands and feet, headaches, blocked throat, noises in the tummy, sweating, which come episodically as you get reminded of the trauma. You can also have a increased startle response, which happens when someone bangs the door or a child cries and makes a sudden noise. You can also react in an unusual way to that kind of situation, that the noise which happens. So you are said to be hyper alert to the noises which are happening in the environment. Then the third symptom group is to do with avoidance behavior. So when you're doing avoidance, you don't want to talk about the whole experience. You prefer to keep it on the side. And also sometimes, like say you had an accident along the road, you will decide to go around, even if you know that the nearer route is going through the place where you had an accident. You prefer to go around as a way of avoiding. So avoidance behavior can come through that kind of way. Then the other symptom groups which happen, which are called dissociation, whereby you feel detached and you are numb from the experience. You want to behave like the experience happened to someone else when it happened to you. So you become numb. It can also happen. But the other three main groups are the most important ones. The risk factors for people to be having post-traumatic stress disorder. The common one is adverse childhood experiences. Maybe in a childhood, these bad experiences, these traumatic events, or child abuse, or any other traumatic events which happened in a childhood. So when you're older, you become at higher risk of PTSD. People are also at risk of PTSD if maybe this thing has happened to you before and then it's happening again. Obviously, you become more alert and you are reacting in a bad way to the event. It's common in females, it's another risk factor. And sometimes in your genes, in your family, you find some people in their family, they're just prone to reacting worse than other people. So that can also happen, becomes another risk factor. Then sometimes there are also what are called resilience factors. Maybe if you don't get help early, you may find you struggle to cope with this traumatic event. And sometimes if there's persistence of the trauma, maybe you've been raped and you keep on getting raped by the same person who's staying in your house, obviously the PTSD is not going to go away. So it becomes a risk factor in itself. And sometimes also survivor guilt. If you survive a traumatic event, and sometimes, say for example, I remember a client was in the DRC who watched his sister getting raped by the rebels. And he was there watching. He couldn't do anything because he wanted to save his life. But afterwards he was feeling so guilty, he wished he had just come out and saved his sister from the rape, but he knew he was going to get killed together with his sister. So common sense told him to stay, but then he was feeling guilty afterwards. So survivor guilt can also become a factor because you wish you had done something to prevent the trauma. Yeah, there are several treatments available. Obviously, we prefer to prevent if we can prevent issues of rape, child abuse. We want to see how we can prevent that. That would be the first line of attack. We want to prevent, if we could prevent wars, we would go ahead and do that. If we could do something about floods, you know what happened in cyclone. In the came, people were told to move and some people were refusing to move. But then in the end, they were all exposed to the trauma and they were suffering more. So sometimes you have to prevent. That's very important. But when you have the symptoms now, you must do what is called psychological first aid. It also helps to treat people before they develop post-traumatic stress disorder. So psychological first aid, basically, it addresses the psychological concerns and also the social concerns of people to prevent worsening of the condition in future. So if you can do those things, you can actually help reduce the incidence of PTSD. But when you have the symptoms now, sometimes they come together with symptoms of depression. So you want to treat these patients with a drug which is going to stop the flashbacks, which is going to stop the anxiety. And also you want to throw in an antidepressant, both usually coming up with things, symptoms of depression as well, so you want to help them with that. So medically, you want to calm down the patients and hopefully they will get better, but they usually never get better unless there's a psychological intervention. So in terms of psychological intervention, people do what is called cognitive behavioral therapy, trying to look into the causes of the trauma and your thinking patterns of how you relate to the trauma. So when you address those thinking patterns and then you change the way you think, hopefully you change the way you relate to the trauma which you're exposed to. And then other type of psychotherapies is what is called narrative exposure therapy, whereby you actually have to talk to a specialist, someone who's trained in treating PTSD, and then you relate to them the experiences you're going through, and then they help you to discover where you are really getting it from, and then hopefully they help you with the treatment.
Okay.
And then the other type of treatment, which is quite new, it's called EMDR, eye movement desensitization reaction. So that one, the EMDR, when people get this EMDR, it's more like hypnosis, but it's actually said to give the best response to therapies for PTSD. It's actually, family and friends should obviously help in terms of the prevention, if they can help to prevent the traumatic event from happening, very good. But if they can't, in terms of helping the client who is suffering, must be able to identify the symptoms and help the person to go and seek help as soon as they can. And then in terms of the symptoms, when you're at home, someone maybe goes into a panic attack or there's severe anxiety because of the post-traumatic stress disorder, family and friends can actually help this person to maybe to relax, do relaxation exercises, to do breathing exercises. They can also be taught to help the person to calm down in that way. And also maybe to just help talking to people who are going through this kind of trauma, to distract them from focusing more on their traumatic event. Sources of help are mainly the mental health institutions. Every hospital, every health center in this country is supposed to have someone who is trained in mental health care. So hopefully if you visit any hospital, any institution, you should be able to get some kind of help. There are psychologists, there are counselors in the community, your church, community leaders, all those kind of people. Even if they are not trained, sometimes they can help you to reduce the symptoms. But if you really want to look for the trained people, for your social workers and your counselors, your clinical psychologists and your psychiatrists and other doctors who are interested in the field, they can also help you to reduce the extent of PTSD.